Hello and welcome to ABiQ's webinar. This month we're looking at how we can develop or achieve effective, cost-effective and sustainable healthcare for all in Africa. I'm delighted to have with me on the panel today a really extremely diverse set of young professionals to contribute onto this topic. So I'm going to quickly introduce you first of all to Benita. Then followed by Benjamin and Chezi. So Benita, over to you if you can introduce yourself.
Hi everyone, thank you for being here. I'm very excited to be sharing this moment with you. So my name is Benita Kayembe. I was born in Congo, Kinshasa. I kind of grew up there and then I moved to the United States where I attended Cornell University and I majored in international agriculture and rural development with a focus on economics development and a minor in global health. And I am currently working with Job Corps, which is an agency, a federal agency that looks at young people 16 to 24 from like underprivileged communities to kind of give them the education they need and give them better jobs and kind of pull them off poverty. So that's a little bit about me and I'm very excited. Nice to meet you.
Excellent. Thank you very much, Benita. Benjamin?
Hi, thank you for having me. My name is Benjamin Fields. Right now, I'm a current graduate student in sociology and demography at the University of California, Berkeley. I have undergraduate backgrounds in sociology, public health, and demography. And I'm from Tulsa, Oklahoma in the United States, but my dad's from Cameroon and my mom, she's from Louisiana. So that's partially that's the reason why I'm interested in healthcare in Africa. I have a little bit of research experience doing public health work in sub-Saharan Africa and Malaysia, and I also have teaching experience in public health.
Excellent. Thank you very much, Benjamin. Over to Chezi, if you can introduce yourself quickly.
My name is Chezi Vomer. I have a doctorate in lab medicine in bioanalytical and clinical chemistry. With 11 plus years of experience in lab medicine, I'm particularly interested in the wellness of women, children, and the elderly. I am also particularly interested in seeing how we together can advance the state of healthcare in Africa to make it more affordable and accessible through the different sectors of healthcare. Thank you.
Excellent. Thank you very much. Right. So just to give us some context, I would like to maybe just share a couple of slides, just in terms of explaining to our audience the drivers of healthcare, overall investment in Africa, or the need to develop infrastructure in Africa, but looking obviously specifically at the healthcare side of it. So going on to the first one, just in terms of looking at drivers for growth. So one of the things that we need to realize about Africa is that over the next 10 years, so that's 2020 to 2030, Africa's population is going to grow by 25%. That's an enormous amount of people that's going to be added, to that continent. We're going to have 400 million youngs will be born between now and then over the next 10 years, and then we're going to have 300 million more kids to educate. 50% of the world's working age population will be based in Africa by 2050. So enormous growth. We can see specifically Central Africa, where we have, close to 30, well, over 30, almost a third of the population will increase by over a third of the population. So 32% growth just in those numbers, really significant. Going on just in terms of healthcare, so what we've done is we effectively looking at, what's a standard hospital that you'll find, at least have, emergency services, 200-bed facility. What is the cost associated with building a hospital like that? And then, what is the ratio of beds in each of those specific countries? Then looking at this population growth, how many beds do we have to add, and work that back to how many hospitals do we need? And then we can see astounding numbers. So over the next 10 years, we're going to need close to 2,350 hospitals across the continent. 468, 500,000 beds, hospital beds is going to be required. And we need to train and educate another 67,000 physicians to obviously man these facilities. Again, assuming 50 million for a 200-bed facility, you know, it's $117 billion just in physical infrastructure. So that's not even developing or training. That's just having the building there with the beds and the means to accommodate people. That excludes all the training and all the, you know, all the requirements on the fringes of just the physical infrastructure. So just by some of the main markers, the main countries, we have Egypt, Nigeria, Ethiopia, Kenya. These are all countries with large populations. And then overall for Africa, you can see that you're ranging from Egypt, $6.5 billion required, up to Nigeria, which is going to require almost $20 billion of investment just to build this healthcare infrastructure. Again, another topic, it is, you know, are we going to finance all of this? So there's various sectors that we looked at, from housing, you know, healthcare, education, and so on. But overall, Africa is in need of, you know, close to $3.8 trillion of investment just over the next 10 years to maintain the status quo. That's not to improve necessarily. This is just to maintain status quo, which is astounding. It's significant numbers. So with that context, let's go back to the panel, and then we go to Benita. And maybe just from your perspective, what do you see as the main challenges facing Africa's healthcare sector at this point in time?
I would say, like you just, thank you for talking about everything you just said. And one of the main issues is that fewer than 50% on the African continent don't have access to modern medicine, which is a big issue. And also some of our countries in Africa only spends 10% of the GDP in it. You know, there might be many reasons why they do that. And I mean, in Africa, we have many issues. Healthcare is just one. You know, there's housing, there's agriculture, and there are all those things. So how do you prioritize healthcare over, you know, other things that are happening? So that is a big issue that, you know, many of our politicians need to be thinking of, because I believe that healthcare is a main priority, because it affects all the other areas. You know, good health leads to good education, leads to good economies for the countries, and definitely the growing population. I mean, there are estimates that by 2050, the African population is gonna more than double. So how do we respond to that? Like you said, you know, how do we feed them? How do we provide sustainable healthcare? So those are some questions, but also it means things like corruption too. You know, how do we remove corruption from the calculation so that resources, you know, we're talking about billions and billions and billions. I mean, I think that billions have been given to African countries, but it's like with corruption, we're not gonna see anything happening from it. It's like we need to focus on removing corruption and actually having focus, you know, not continent-wise, but country-specific of what each country needs to focus on in terms of like the economy, the sociology, the viewpoints of health. Yes.
Excellent. Thank you very much, Benita. If we move on maybe to Benjamin, maybe from your perspective, we've had good input from Benita in terms of a lot of it, in terms of addressing corruption and obviously competing needs from other sectors as well.
Yeah. So I have a few concerns about the development of healthcare infrastructure that are related to specific things in Africa as well as global trends. I think that number one, our demographic data and understanding of the African population in general is probably a little bit unstructured and not necessarily as accurate as it could be. They don't generally run censuses just like they do here in the United States on a regular basis. A lot of our data is based on things that happened decades ago. We don't really understand what the true birth rate, what the true death rate is of Africa's population, the true spread of the ages that are involved. And I think that, you know, relying on projections of the past can give us good indicators as to where things might be today, but we need much more robust information on that to determine the needs of the population. The best way to describe this is that if you have a younger population, you may be able to get away with certain types of policies regarding things like COVID-19, where younger people are not susceptible to death and severe complications as much as an older population would. And so it's very important to know those types of things in order to be able to properly implement health policies. I also think that there's not necessarily a clear-cut path towards the future of what physical infrastructure will look like. With all the types of things going on, like we don't really understand the population, we don't understand the spread of cities in Africa, we don't understand like where people are located, whether it's more rural or urban. I think that it'll be very hard to lay forth a physical healthcare infrastructure system without getting better and more robust information. And also we have no clue about the direction of investment money towards things like that, or whether or not they're going to transition towards data science, where I think the future of healthcare is. We don't know about political inconsistencies in terms of how they're going to spend money, what their priorities are. And so we need to get a better picture of where things are going from a structural standpoint in order to be able to figure out the future of the healthcare in sub-Saharan Africa, or in Africa in general. And one big thing I also think is a huge issue is the lack of awareness of what we need in the future in terms of health, not just in Africa, but at a global basis. I think that harnessing the power of data science is going to allow us to take health to the next level. If you take something, for example, like your susceptibility to certain types of cancer, your susceptibility towards getting a certain disease, a lot of this stuff can be solved with data. So if you have robust data on a particular population or a particular individual, it will allow you to do screenings at the right amounts of time. It'll allow you to figure out when a first line rate of drugs would run out, or when a first line of drugs would be inefficient towards helping a certain population, like with HIV. And so being able to gather this data on a systematic basis without having to deal with some of the social and cultural, like social and cultural issues with people, like having that data harnessed, being able to support physical and electronic or digital systems that are that can bring this data together in. How are you going to convince people to get this data? How are you going to get everyone electronics to be able to implement and give their data? And so this is something that's going to have to happen on a global basis before it happens in Africa. And I think there's a kind of dependency on the rest of the world in Africa to give some resources and give some infrastructure. And so that'll be something that is a big problem, because if the rest of the world don't has it yet and there's a dependency in Africa, then they'll have to wait for the rest of the world to get this before they get it themselves. And then some smaller, I don't necessarily think smaller issues, but issues that aren't as big as the before. In Africa right now, there's no schools of public health. There's no public health entities really that have any kind of significant power or influence compared to something like the CDC or the National Institutes of Health in the United States. Without these, you won't necessarily have the tools or the ability to generate the information that you need for your population or you need for your region at a quick basis without having to rely on external researchers that have priorities for their own countries. I do think that there's also a disconnect between maybe the age that we perceive the African population is now and the age of the politicians there as well. I think that the older generation of politicians grew up in a completely different digital, completely different technological age, and they may not be as willing to adopt the types of technologies you need to harness data science in the future of digital technology to improve healthcare infrastructure in Africa. So there's quite a lot of problems that are at the structural level.
There's a long list.
Yeah, but I think that those are the key problems that the continent will face in terms of developing sustainable healthcare infrastructure in Africa.
We are definitely going to come back to that, because one of the points that you've mentioned it twice now is the data science. So I definitely want to have a bit more of a conversation on that. But let's just get to Chezi quickly. Just Chezi, from your point of view, just what do you believe is the main issues that Africa healthcare sector is facing?
Well, thanks for the opportunity to be part of the panel. I'm just going to add to what my colleagues have already made mention of. They've spoken quite a bit about some of the things I already knew. It's just to make emphasis on clinical trials that would better educate Africans to be able to know how to diagnose and manage their own diseases. And not only having the clinical trials, but also making the data from these clinical trials available to the Africans, that they'll be able to use it in continuing the process. You don't teach people you don't fish for people every time. You teach them how to fish so they can do the fishing when you are not there. If you go to Africa and perform clinical trials, collect data and not share it with them and make it available to them, then you've rendered them handicapped and left Africa to come back the next time and do the same thing. And you're not helping Africa in any way. Instead, you're making them to consistently depend on you and look up to you when crises like the current pandemic come up. Also, it's the situation about, there are a lot of Africans who are out of Africa who are very talented, who are knowledgeable, who have acquired degrees and knowledge that could be used for the benefit of Africa. I think that creating a means of collaboration between those on the ground in Africa, together with those who are in the diaspora, like us who are sitting in here, that we would better be able to use the privileges, the gifts we've had, the talents we've acquired from being in the Western world, to collaborate with those who are on the ground, who know the everyday circumstances, the everyday situations, to see how we can better mitigate and take care of some of these issues that are more prone to Africa. Without this collaboration, there's no way that somebody like myself, who has been in the US for 13 years, would know Africa better than those on the ground. So I think that opening lines of communication between those on the ground and those out of Africa would better be able to help Africa in the healthcare sector and other things that are affecting Africa as a whole. And also collaboration not only also within African countries. So for example, I come from Cameroon. I want to see collaboration between Cameroon, Nigeria, Cameroon, Ghana, Cameroon, Congo. We need to talk amongst ourselves because we have something more in common than Cameroon and the US. So how do we get this going so that together we can form a structure that better suits our issues? The one more thing to talk about is about technology. So it's true that there's a lot of advancement in technology. There's a lot of advancement in technology in every sector. Because this is more about healthcare, I would focus more on the aspect of healthcare. You've seen how we've gone through we are going through the COVID-19 crisis. It's so difficult to have access to testing in remote areas right here in the US. What more of Africa? It could be as cheap as designing a point of care testing device that is worth $1 to make it available to the community. But then we lack the resources. We may have the knowledge, but we lack the resources, the financial resources needed to be able to come up with these devices that would facilitate healthcare. Communicating with clinicians back home in Cameroon, I was surprised to know that a test as simple as hemoglobin A1C for diabetics. Diabetes is something that is afflicting African Americans, the Black race more. But I couldn't imagine that hemoglobin A1C, which should be used in managing diabetes, is not a test that you can easily come by in Africa, in Cameroon in particular. So things like this are some of the things that I believe that financial assistance could be able to help in making it possible that we can better address those diseases that affect us more than others.
Sorry, I believe that there's a common thread of management or lack thereof that's clearly at play as well. I mean, I think we'll get back to possible solutions, which maybe is a good lead on now. If we just go and say, well, okay, we've got a list. We know that there's inadequate human resources. I think all three of you have mentioned that there's just resource allocation, from a budgetary or a fiscal point of view from the governments, but also it's just global in terms of global funding. Where does that go? Maintenance of the healthcare infrastructure, and a big one that came out is the political will. Where's the political will to drive the integration of an Africa-wide infrastructure, healthcare infrastructure? So, some of the other challenges that I've heard as well is, access. We spoke about the data. We're going to get back to the data. How many people is actually urban and how many lives in the countryside. So you've got issues with transport. People, there's no roads to access to get to the hospital. I think maybe one of the big opportunities from my point of view for healthcare tech is diagnostics. Sometimes it could be a simple solution, or at least if you already know where to go, where's the best place or the best treatment facility to go to, that's already half the work done. You find in Africa people traveling for days to get to a hospital only to find out, but can't help them here, or whenever the diagnosis is done, it could take a day or two. Then where do they go from there? So all these issues. So maybe let's go to possible solutions. So I've read a survey in the week just from doctors in Africa, where they kind of come up with a handful of things that they want people to focus on, and that number one was investment in capacity building and training of healthcare workers. And I think we've all mentioned that. Advocacy or political support, there we go. The number two, which we said in terms of the political will at governments to drive investment and development of the healthcare sector. Increased budgetary allocation, we talked about the finances. Healthcare insurance schemes, I mean, that, as far as I know, that is probably in many of those countries almost non-existent. And then you have improved data management and use of data for action. Back to the big data conversation. So just with those 4 items, let's go back to Benita. What would you say from your point of view? What are the main solutions that Africa should focus on?
I would say, like my colleagues just say, one of the main solutions, the way to approach this issue is with data. I mean, we are in the age of big data. Everything, I mean, it's guiding technology. In business, it's like you use big data, you use data science, you improve whatever you're doing, you reach your goals, even in companies, economic companies and stuff. So we have to take that perspective and put that in healthcare in Africa. As of now, we have phones. Everybody has some kind of a phone in Africa. It's like, okay, we are talking about challenges, but those challenges also present us with opportunity for growth. I was reading about how data science was used during the Ebola crisis, where they were actually able to locate where people affected with Ebola were by using data from telecommunication
mobile
companies.
towers, yes.
That was good. So we have that. So how can we use that to even respond to training healthcare, for example? How can you use like data from the past to inform what is going to happen? Because when you're talking about sustainability, it's like building something that's gonna last. We're in 2020. I mean, it's gonna serve people in 2050 when it's gonna be like double of it. So focusing on that, on data, and seeing it as actually something that we can focus on. It has to be also country specific, because looking at even the census, we don't know who is who, how many countries, how many people is there in Congo, how many people is there in Kenya, all those things, besides Nigeria and South Africa, who did theirs in 2006 and 2011. It's like we don't know who we are serving. So it's, data is very, very important. And I think we should use that also to focus on the changing needs of the population, as Dr. Shezi said. We're coming from a population that was mostly communicable disease based. We were used to deal with malaria and all those things. We were just so focused on that. But now it's like we have diabetes. We have people experiencing with those sickness that we used to think that like only in Western countries. We have to focus on that. But again, we need data. I mean, data is the answer to all those things, to lead big decision, like efficient decision making, even policy, even how to implement them. We need to have data. We need to know who we are serving in terms of urban and rural areas to make it efficient and better. So I definitely think that data is the key where we should start.
I like it. I really do like that. Let me just make a comment there about the data. I just quickly looked. So 2018, I know it's, we're 2 years later now, but based on the World Bank, Sub-Saharan Africa, 82% of the population had mobile access to mobile phones. So, let's say roughly 850 million people in Sub-Saharan Africa has got access to a mobile device. I haven't spoken about, diagnostics, because that's, again, big data. The point is, if we are able to do, first phase diagnostics wherever they are based, whether it's rural or urban, doesn't matter. That data is already worth so much. Just knowing that the person is there, that's already a contribution. And then obviously moving on to the next steps. Okay, the diseases or whatever the applications are and the kind of data that it can collect and obviously share on a single platform. That would be fantastic if that was available for Africa. So there's obviously scope for something to develop here. But yeah, so totally agree with you. And on that subject, big data, Benjamin, and I think you've got a passion for this. What is your input here? Would you say, where's our solutions going to be?
I do agree with my colleague Benita. I think that big data is the future of the healthcare infrastructure system. And I think it's the future of a lot of things. And I think that being proactive and jumping ahead and getting with what the future is going to be will yield big benefits for Africa. I do want to preface and say that there are some physical, social, and cultural things that we'll need to do in order to facilitate this thing as quickly as possible. I think, for example, that, adequate access to transport infrastructure, for example, being able to get out to remote areas safely, efficiently, all parts of the year, even during the rainy season and non-rainy season, for example. We need things like that to facilitate the transfer and the spread of the ability to, physically be able to interact with communities, physically be able to give care, physically be able to give resources. I think that also.
I want to mention there, because I think that for me is a bit of a challenge, because we even 2020, if you go and look at the transport infrastructure in most of sub-Saharan Africa, with the exception of a handful of countries, it's almost non-existent. It is in such a poor state, and the amount of money that you actually need to do that, I just don't see realistically over the next 10 years that that's going to be, not saying that it shouldn't be done, but just saying that I can't see how, as a priority or where they're going to focus, that's actually going to happen. I do think, let's just assume it's not going to happen, or it's not going to happen quick enough. What else can we do with big data and to do some of the, I don't want to call it home treatments because that's the wrong word here, but I'm just saying that, this mobile device can do a couple of things for me. I've got these conditions, help me, and on a certain case prioritize and say, okay, you need to get here. And it might not be just in town, it might be a different town. So if you get, I just think that transport is going to be a key issue, and it's not something that they're going to solve quickly. So in the light of that, what else can we do?
I think that Dr. Chessie has a comment real quick before I go.
No, not actually a comment. I was just going to pop in and kind of say ways that we could not make lack of infrastructures like roads be a big deal in the absence of healthcare in Africa, because of the availability of remote and mobile healthcare services. This could be taken to Africa to make it to be able to complement, for the absence of adequate roads and infrastructures. Because of the kind of things, the kind of diseases that we commonly suffer from. I think that for the most part, if we make these services available, something as simple as mobile phlebotomy, something as simple as being able to have someone without relocating, be able to have someone do your blood work, send the results to you digitally, and you have a clinician or someone, a nurse, who meets with you remotely on a digital device to be able to discuss your results and the next steps. And that way we can be able to overcome the obstacles of infrastructure.
Totally agree with that. Benjamin? Sorry, Benita, you want to say something?
I just wanted to add to that what Benjamin, Dr. Chessie said. We don't have to bring them to a place to get help, but we need to go to them, because I think we talk about urbanization and big cities. I think that most of our population are rural based, based on estimates. And I also, I mean, we're talking about modern medicine, those are, you know, Western based, you know. I do believe in traditional medicine that we have. I mean, it worked somehow. Those people actually use it in some ways. So how can we integrate that in those communities, you know, and actually train healthcare workers in those communities, just going there, you know, with the mobile medicine and all those things, integrate them together. And it's like we talk about modern. I mean, what is modern? So there's an opportunity for African countries to focus, to tap into the traditional medicine that we have had for years in those places, and build a hospital that actually relate and match with those people's culture and tradition to make it easiasier.
I think it's an opportunity for Africa to lead here.
Yeah.
I think it's there's absolutely an opportunity for something for Africa to develop for Africa. Benjamin, back to you. Sorry, I rudely interrupted you and took the conversation completely in a different direction, but let's get back to the big data.
No, I think that stuff is really important. And I think there's also some other things that are kind of related to that I want to talk about before big data. I think that also, for example, not just in terms of transportation infrastructure, but just in terms of digital and physical infrastructure. And so you need things like everyone needs access to a phone, but these phones need to have advanced capabilities. So smartphones compared to flip phones, you know, phones that are capable of harnessing a lot of harnessing a lot of power, connecting to the internet, being able to institute complex tasks, being able to integrate themselves with upcoming technology that can be paired with the phone. You know, for example, we need things like blood pressure monitors. We need things like glucose monitors. We need tablets as well. We need computers. We need, you know, database infrastructures. And then we also need access to internet. There's a lot of places that it's hard to get internet, or you can't get unlimited data plans or unlimited Wi-Fi plans like you can in other parts of the world. And so that will severely kind of impact our progress in terms of being able to use technology to our benefit until we can get those things implemented. I also
5G.
think and I think it's a chance for Africa to become a leader as well. And I think that we also need, for example, manufacturing. Manufacturing is not really an industry in Africa right now for many different reasons. And I think that there is a possibility that somehow we can break out of the chains as the reasons why we don't have manufacturing implemented. I think that being at the end of a global commodity chain and having to rely on other countries or having to rely on competitive advantages to be able to trade for certain types of things, you need manufactured on a rapid basis, or you need manufactured for your particular local needs. I think that having the ability to do that will severely magnify the amount and the magnify your ability to be able to help address problems that need this physical infrastructure, et cetera, or the products that you would manufacture in terms of being able to help the medical care system. And I also think that there are some political things as well before I move into data science. And so you need health bodies that are strong, informed, capable of generating their own information, and have the ability to implement changes, policy, and control things whenever health crises come into effect. You see in the Western world that these don't necessarily exist as strong as they do in different parts of Asia. And so when you have weak institutions that can't really influence things societally or can't control anything when there's a health crisis, you can have an abundance of information, an abundance of data, an abundance of policies that you know would work. But because of the lack of the ability to, you know, implement change or implement policy or implement, you know, some kind of law, you won't be able to be effective. Whereas in Asian countries, it exists much more. And so we kind of have to get into the debate of, you know, what is the role of different parts of government? What's the role of health agencies? What power should they have to legislate change, et cetera? And then the final thing I think is also, you know, the idea of the brain drain, which Dr. Chessy talked about. There's a lot of talented individuals from Africa, and there's a lot of, you know, talented individuals still residing in Africa that I think we neglect. We don't really have a school system that's as strong and robust as those in the West, as those that are developing in Asia and schools like NUS, Tsinghua, Peking. So we need to be able to develop schools, seek out the talent, and then nurture the talent that we have, and then bring back the talent that we have in order to have leaders in this industry that are young, up and coming, and able to assume the roles that our older generations have done in the past in terms of running the countries and running the different sectors. And with those things in implemented in the future, hopefully in Africa, that will give us the ability to finally start collecting huge amounts of data, being able to store it, being able to interact with different people, being able to be innovative in the ways in which we collect data at the individual as well as community and country and region level. I think that having this data is going to fundamentally change the way that we go about things, because I don't think people have been creative in terms of understanding what data can do for us. If you, for example, look at someone's blood pressure, or you look at someone's, screening records from, T blood cell counts from HIV or anything, if you compile these over time, look at them in graphical format, look at them in calendar format, in terms of charts, you'll be able to find trends that can give you the ability to locate things, or, predict events like heart attacks or cardiovascular disease, your first line of drugs not working anymore. I mean, and then you would also be able to, for example, take a particular disease, give an odds ratio that a particular person would get that disease. You could create screening schedules that would rapidly accelerate up to the expected point of a disease or the expected point of a complication. I mean, the opportunities are endless. And I think that we haven't thought creatively about that yet, because we're still focusing on, globally, we're still focusing on a healthcare system that is treatment-based instead of prevention-based. And so I think that Africa can really be a great leader here, because we don't necessarily have like the infection of certain types of things that are bad for society. Like a huge fast food industry is based in the West and it's spreading to other parts of the world. And you can see, for example, obesity rates following that, cardiovascular disease following that. You can see sedentary lifestyles developing in the West and other parts of the world, and then how that's affecting your health. And so we have the ability to not only stop those things, but to implement data, because we're so new, because we don't have an underlying way that we go
legacies.
about. Yes. And I think that we have a very powerful position and can leverage that and become world leaders in the healthcare system.
Fantastic. Thank you very much for that, Benjamin. Dr. Chesi, if you, maybe from your point of view, more ideas in terms of how we can, develop the African healthcare system to what other solutions are out there?
My colleagues have pretty much said a whole lot that I would not want to just beat on the same points. I'm just going to add a little bit of flesh on this whole idea of data collection. Yeah. So I strongly believe that if they provide culturally competent training that meets the needs of Africans, whether be it Africans or African Americans, because you have Africans everywhere. If that even begins in the Western world, if that begins in the US, I'm sure if you study me in the US and a group of others who look like me, you are indirectly studying Africa. So I believe that if clinical trials are made ethnocentric, such that, and they are conducted such that they include people of the African descent, that they include Africans, that they look for ways of getting them involved. I know historically things have happened, like the Tuskegee trial, that have kept Africans away from clinical trials. But I believe that if we find a way of including Africans and people of color in clinical trials again, in the Western world, not even done in Africa, we can indirectly solve some of the problems, healthcare problems in Africa. That's how we begin, by generating that data. You don't have to go to Africa to study diabetics in Africans, So that's one point. And meanwhile, the same clinical trials can also be done in Africa. But again, as we continuously talk about resources, lack of infrastructure or financing, we have these clinical trials already going on in the Western world. How about we do everything possible to make sure that we include Africans in these trials, whether it's a cancer trial, whether it's a diabetic trial, obesity trial, just anything. Some of those things that are inherent in the African community. How about we make sure, currently, some data that I had access to shows that you have 4% of Africans in some of minorities in cancer clinical trials. And I saw the data really looks not so good. even like studying minority women. In the case of trying to improve on healthcare or maternal health in minorities or in Africans, because they are more prone to, they have a higher death rate when it comes to childbearing. How can we study those Africans who are in the diaspora to be able to help to provide this data to Africa, to give them a baseline from where to begin with, without necessarily having to go to Africa? The other point I was going to talk about, just adding a little bit, was the idea of innovation. Again, I believe that because of the so many talented Africans in the diaspora, and that there are so many opportunities that I come across, but for the most part, they would either say you need to be a citizen of America, you need to have been a resident, you know, the restrictions go on. And then you'll find this very talented African who has a great idea, but does not qualify for this funding, for this grant, for some innovative idea, just because they are not citizens or they are not residents. You know, I think if we make available, if they make more grants that would meet the needs of minorities, of Africans, by not restricting it to American citizens or residents, they would be indirectly also helping out with the health crisis in Africa. Those were the 2 points that I was going to add to.
I think it's a valid point. I mean, I can mention that, you know, we're obviously based in Dubai, and for example, we have there's an event coming up in December called GITEX, which is specifically looking at tech, and they actually have a section looking at the Africa Investment Forum, where there's $100,000 up for grabs for anybody that comes and pitch the best idea. You know, so not that it's an answer, but there's idea. I mean, the point is, there's certainly a lot more interest in terms of Africa and solutions for Africa from Africa. And we definitely, if you speak to people and they have issues in the US, they get in touch with us. You know, we have you know, colleagues down the road here that can put them in touch. You know, at least with events where they can pitch their ideas, and there's chances of, you know, where they can get funding if it's a great idea. So, and I think the main comment that I make, I understand from your perspective from the US, but I think, you know, also from there's a lot more people taking interest and note of what's going on in Africa and offering opportunities like investment in new great ideas as well. So just in terms of, we spoke a lot about the politics and in terms of management or the lack thereof as well from a political point of view. And then we've looked at the opportunities in big data. I do think that we've touched, you know, the key issue in terms of how do we develop something in Africa that can help us collect and collate data and also be actually something useful. You know, we want something where the people can use and it's to better their lives. There's way too many, I think, ideas and concepts out there with it, you know, with good intentions, but it collects a lot, but not necessarily improving quality of life. But I do like what I've heard today in terms of big data and what it can do. I think I'm just going to go to a couple of questions quickly. We've got about 15 minutes left. So we've got a couple of comments just saying that telehealth and AI would be very scalable, you know, comparable to what we've seen from fintech. So maybe the one question, you know, for you as a panel is, what are you seeing in terms of coming out of Africa, or do you think elsewhere there's some developments that's out there that we need to take to Africa? I mean, I think very definitely the, you know, AI and big data, the correlation or let's call it the scalability of it rolling it out to the continent has to go hand in hand with the rollout of telecoms infrastructure, because like we said before, that doesn't help. We have 85% of the people with a mobile device, but, you know, can't afford the data or, you know, to use it, you know, because then it loses its benefit. So I see, Benita, you've got your hand up.
Yes, I mean, based on your question and based on something that, you know, I think we spend too much time focusing on data, But, you know, at the beginning, I talked about corruption in the public sector, and we also have to talk about leaders. I mean, you know, with coronavirus, with everything that happened, we saw that most of our leaders in Africa, you know, when they were getting sick, they're going to hospital, you know, in Western countries. I mean, that has to stop. I think we need good leaders. We need leaders who have to choose to focus on the problems we are facing. Unless they do that, you know, we can go with all the ideas of AI. We can go and tell them that, you know, we have telephones, we can use data, we can use the diaspora. I mean, I do believe that we have human capital in Africa. You know, that's why we talk about brain drain. That's why, you know, so many move from Africa to Western countries, even within the continent itself. And I have a degree from Congo. I choose to go work in Nigeria, in South Africa, and vice versa, because we have it. What we like is good leaders. We need to have leaders who will be focusing and who will see the good in our population and who will be deciding to invest in us. You know, corruption, it's because they're not fighting it. You know, good infrastructure, it's because they're deciding not to focus on it. I do believe that, you know, we need good leaders, and that's the first thing, especially coronavirus. You know, they don't have to go in America anymore. So this, you know, this is a very global health issue that is really bad, but I think it's something that has to show us, you know, we need to start making it in our countries, for our cities and for our people first, and look at the human capital that we have. How can we develop that before we go elsewhere? I think that's a good really point that need to be made, and something that we need to focus on.
Excellent. Anything else from you, Benjamin?
Not for right now. I think that Benita did a good job of summing up everything. Dr. Chesky?
The one thing I would like to add is there are African countries like Nigeria or Tanzania that have come up with like COVID-19 tests. I think that if there's an African market to encourage made in Africa, to see that we use those things that we manufacture in Africa, we can also be able to help with our economy, as opposed to importing from China and everywhere else all over the world and not using our own products. We should be able to promote our market.
Totally agree. We saw this week the approval of the ACFA agreement, so the free trade agreement for Africa. So I think something like this would really go well together with that. Made in Africa, you know, by Africa for Africa. Fantastic opportunities. Just going back to maybe a couple of more questions. So a question to Benjamin and Dr. Chesky. So I'll just read the question. To avoid sweeping statements, I think to make fair analysis of data on healthcare infrastructure in Africa, distinction should be made between Africa's advanced economies and less advanced economies. For instance, in advanced economies, data is available. Policy, red tapes, and corruption are the major hindrances. You know, and then of course, for lesser developed economies, there are gaps, admittedly, with regards to data. And then, you know, the comment was made, innovations like rapid COVID test in Nigeria should also be applauded. Totally agree with that. Any comment from you, Benjamin or Dr. Chesky?
Well, when it comes to data availability, that's true that when we talk about Africa, for example, I cannot compare I cannot compare Cameroon, where I come from, to South Africa. That's clear. Yeah, so whatever it is, again, it takes me back to the idea that I said we should collaborate, we should work together as a continent. So if South Africa can be able to share with Cameroon, or Cameroon seek assistance from South Africa to be able to know how they get what they have, I think it would also be a source of resource and a starting point while waiting on external sources of assistance. So it's true that there's a gap in the data, in how much data is available, and there are also bottlenecks when it comes to politics and the leaders. But then I think we can also, the whole idea of having Africa work as a team is very important. That we share resources, we share knowledge, we collaborate, like researchers collaborate, come together. One person has money, the other person has people. how do you get labor and put together with the finances to make it happen for Africa? So I think that those are ways we can resolve issues, the discrepancies in data that exist even in Africa.
Okay, very good. Appreciate that. Thank you. Benita. Yep. I think you're still on mute.
Just to add to that, we talk about being in the age of big data. I mean, hundreds of thousands and billions of data are generated every single day now. So we need to also focus on the timeliness of it. You know, data that is produced today, you know, it's not going to be worth it in 1 month. I mean, just to look at the modern world where we are now. So of course, you know, I mean, we have, you know, that's why at the beginning I say everything got to be country specific. South Africa, Congo, Nigeria, Cameroon, Egypt, and we are all different, you know, but also we need to be having the velocity and the veracity of data need to be produced every single time, you know, to keep up with whatever is going on, because that's the age in which we are right now. So I think is what, but also we have to look at how much data do we have, how often do they collect it, and how are they, you know, are they better at actually analyzing it on a, you know, with good timing?
Real time. Yeah.
Okay.
Benjamin.
Yes, I do think that there are specific instances in which there are definitely things to applaud in Africa. I do think I saw the question, for example, the rapid test in COVID and the rapid test in Nigeria. I do think there are some countries that develop amounts of data that are respectable compared to other regions of the world, but I don't think that people really understand. We haven't even reached the tip of the iceberg. Or if you look at in terms of what we can do with data, right now we're doing a pebble of sand compared to sand on the entire beach. I mean, the opportunities are endless, and I could easily explain multiple scenarios in which you could use data science to boost your life expectancy to well over 100 years. You could prevent pretty much almost every form of death. I mean, you could harness the amount of data that you can use to stop diseases, to circumvent, I mean, to prevent pandemics. I mean, this kind of stuff is, I mean, we haven't even come close to imagining impossibilities. And so I think that we should applaud what's going on in Africa now with data science, but I think that we should be a little bit tough, and we should be a little bit more demanding of ourselves, because I do think that there's an ability to leapfrog to be global leaders in data science. Because I think, for example, there's a lot of ideological things that happen in the Western world in terms of like what we do with data science, like people's willingness to give data, you know, a lot of conspiracies about what can be done with data. And then because of the economic structure of the West, you know, companies are not necessarily enticed to use data in the best ways possible for health as much as they're used to make money. I know, for example, that Google sells extensive amounts of data for people in order to make money on marketing, but not much of that data is used, for example, for public health interventions and other things. And so I think that Africa has a really big chance to leapfrog, but I think that we have to be hard on ourselves, and we have to be more strict, and we have to be more longing to try to get in that position, because it's not going to be easy for us where we stand right now globally. But I think that, you know, being ambitious is definitely going to get us where we need to be and where we want to be. We
got to look at the picture 20 years down the line and try and work back, where we want to be in 20 years. Yeah, fantastic. Right, so we've got 7 minutes left. I actually just want to go around one more time through to each of you. And I just want to say, today, you heading up Healthcare Africa, what is the first 3 things that you would do? Benita, I'll kick off with you.
Oh, the first thing I will do my best to choose good leaders, because I think, you know, that's why we call them leaders, the leader guide. So we need good leaders in the healthcare industry. Also with human capital, healthcare training, I think we need to develop good cities, good economies for people to not leave the places where they have. I mean, if I'm training a doctor in my city, I don't want them to leave my city to go in another country just because they pay them better. So how much those leaders should be investing in the healthcare industry, especially the human capital, you know, training community health workers, because, you know, sometimes it takes too much long to go to an hospital. If we have a healthcare workers in the community, that is going to help. So that was the second thing. The third thing, I will say, I mean, it's good to have modern medicine. I will want us to focus on integrating traditional medicine into modern medicine because it works. I mean, as of now, I gave an example, the healthiest group of group in America, you know, there might be Hispanic women that are looking at, you know, what is the reason why? I mean, some hypothesis is because they actually embrace like the tradition and the traditional medicine. So we have good things that works. Of course, we need to do more research on that, but we have a lot of rural population who believes in those traditional medicine. So integrate it into modern to make things look better. I think those are the 3 points I would definitely focus on.
Excellent. Benjamin, from your point of view, what's the first 3 things you would do?
So I think mine are a little bit more structural and they're much harder to probably imagine doing, but I think that the first step that you want to do is change the geopolitical power relations between Africa and the rest of the world. I do think that there are a lot of neo-colonial policies. There's a lot of things that are done by large intergovernmental institutions and other things that kind of take advantage of Africa's recent, for example, independence, take advantage of some of the facts of, you know, their resources, take advantage of the facts that we don't necessarily have manufacturing to be able to make our own things. And there are kind of some things that in rules and things like structural adjustment that kind of hold us where we are and kind of constrain the choices and things that the leaders can do. I do think that, you know, for example, corruption is a big problem in Africa, but I do think that leaders are, I mean, they're kind of constrained in what they can do. You know, there's not much, I mean, for example, when you have a lot of loans that you have to pay back and, you know, you're inside of certain policies and you have to promote certain types of business interests because of the World Trade Organization, like there's a lot of things that you can't do. And so fixing our geopolitical power structures and where we relate with the rest of the world will give us the ability to break out of those and then have free capital we can spend freely on what we want. I think number 2 is develop strong institutions at the government level, at the education level, and at, you know, for example, ministries of health that have the ability to each gather their own data, make their own decisions, fund their own things, generate what we need for the population and serve the needs of individual Africans, you know, not just here, but globally. And, you know, that will attract a lot of the diaspora back, and that will attract a lot of people back to prevent the brain drain. And I think number 3, that's when you have what you need in order to start saying, okay, well, let's start rolling out very advanced tech, you know, like iPads or, you know, the latest models of phone, or even create our own versions that are much better than the versions we find in the Western world, because, you know, no company lasts forever. And, you know, after you get to a certain point, like your tech is phased and you're stuck in that kind of way. And so implementing those types of things and gathering certain amounts of data, you know, educating the population in a way that we're not introducing dogma that prevents people from being willing to give data, you know, develop cybersecurity measures and all other types of things that we need in order to harness this power of the digital age that's coming.
Excellent. And lastly, Dr. Chesi?
If I were going to do the 3 items I have that I would make priority is the first one is innovation and technology, to see how we can upgrade it with the level of innovation and technology that is available for healthcare and the services of healthcare. That way we make healthcare affordable and accessible because majority of Africa is deals with rural communities. How do you meet the people in the rural communities? By improving on innovation and technology for healthcare and the services of healthcare. The second thing in mind is education. It's health education pretty much, not just education. That to be able to create programs whereby you educate, inform, and remind people on what it means to live a healthy lifestyle. Something as simple as nutrition, something as simple as your diet, something as simple as getting the right amount of sleep, you know, something just eliminating stress in one way or the other should automatically keep you away from seeing the doctor. So how can we to provide education to encourage healthy lifestyles, right? And the third thing, it's about encouraging African countries, seeing how doing all I have in my capacity to see African countries work as a continent, and not that Nigeria is comparing with Cameroon, you know. But then you realize that the president of Nigeria is sick and he runs to Switzerland for treatment. How about just fixing Nigeria, fixing the healthcare in Nigeria, so that you have to just get the healthcare in Nigeria? The president has the finances to go to Switzerland, but when the local person is sick, that person cannot go to Switzerland.
No.
Yeah. So those are the three
Absolutely.
things I feel that I would want to begin with, to see that we improve on healthcare in Africa.
Fantastic. It's 3 o'clock here in Dubai, which brings us to the end of our webinar. I want to thank you all. This was fantastic discussion. Thank you very much for your participation and contribution. We will be sending out, well, this is recorded and will also go onto our YouTube channel. And we will do a bit of a type up on this and then distribute that to everybody that attended, as well as with these last points in terms of action points, which I kind of like. And hopefully we're going to do this again. So thank you very much. Have a good day, and hope to speak to you soon. Thank you very much. Goodbye.
Bye.
Thank you for having me. It was a pleasure, and it was nice speaking on the panel with Dr. Chessie and Benita. Thank you.
Thank you very much, everyone. Thank you.
Speak soon. Take care. Goodbye.